Well, good afternoon, Uma. My name is Tanikka Price. I'm with Health Impact Ohio. I wanted to spend a little bit of time interviewing you. We thank you for all the hard work that you've done in the Central Ohio Pathways Hub, but we did want to spend some time getting to know you just a little bit better. So thank you for joining us, and we'll go ahead and get started. Can you please introduce yourself and tell us a little bit about yourself, your role, and the agency that you work for?
Sure. Yeah, thank you for having me here. Tanikka, good afternoon. My name is Uma Mishra. So I'm working with Franklin County Public Health since April 2021 as a community health worker under health system and planning. So yeah, before that, I was working with one of the social service agency as a case manager for victim of violence services.
Okay. And what inspired you to become a community health worker?
My experience working with immigrants and refugees with that social service agency, I came across so many people who are not aware of the local resources lying around in the community and their neighborhood. So I felt like I should stand forward and advocate for them, help them share the information which are like just they are not aware of it.
Now, how do you think that your background and your experiences, the things that you've gone through in life, how do they inform who you are as a community health worker or how you help those in the community?
I came through a refugee background, so I'm an immigrant. So I went through so much when I come to this country. Later on, I knew that there were so many resources, there were so many people standing behind to help people who are with a low income, who have limited English. But I didn't know in the community. So coming from a new country with a new language, with a limited English, I had hard time. And I passed so many years with a hard time. And when I started working as a case manager in Chicago, I learned more about the community. Like there are so many community members, individuals who are just like me, who are in need of help from someone else, but they don't know how to approach, where to go for help. So they lost everything to nothing. Like they had house, they had job, they have car, but later on, with some situation, with some circumstances, they lost everything and they had nowhere to go. So and then I work with the homeless population, with HIV population in Chicago. And then when I moved to Ohio, I work with some other populations. So I learned so many things from them. They taught me and I taught them. So this is how I started working with them.
Yes, excellent. Thank you. Now, what is one thing that you wish people listening or watching this, what is one thing you wish they would know about your experience or your experience as a community health worker, or even the experience of the immigrant population that you serve? What's something that you wish they knew about your experience?
I wish they should know that community health workers are just like the providers. They provide services in the hospital. Like we are not certified doctors or nurses, but we have some handful of resources that we can provide. We can advocate for them. We can pass the information that are relevant to their situation. And also I would like to let them know that we provide free services. They don't have to pay for our service from their pocket. So we provide free services to the community.
Thank you. Now, speaking of services, throughout your time at Central Ohio Pathways Hub, we have noticed that you've closed quite a few social service for food security pathways, meaning you've been able to connect people to the food resources that they so desperately need, especially in these hard times, these COVID times. Do you have a story, or can you remember one specific case that you'd like to share with us that really stood out where you connected somebody to food?
Sure. Yeah, so food plays a very important role in one's health. So without food, people cannot regulate their life. And food is the main important ingredient in the body that regulates the different part of the organs, and they need nutrients to operate day-to-day life. So, for example, during the power outage in June, last second week of June or first week of June this year, many of my clients lost their food. The food went bad from the refrigerator. Their power were like gone for like 24 hours, 48 hours. And they had limited money to buy food from their food stamps. And some people, they don't have food stamps, so they had to rely on the food pantry. If there is no refrigerator like working well, then they cannot bring food from the pantry. So I decided to jump in and order some request some food from Name app so that they will deliver some food in their house. So I did one example for one of my clients who delivered the baby in May, and she had no food stamp. We applied and they kept on denying her application. I don't know the reason, because when I called, they said, I cannot speak with you. So they wanted to talk with the client, but client cannot sleep at night because of the baby. So she has to sleep during the daytime when the chance comes. So I had that client, I delivered the food for her. Also, I ordered the food for her. And so that saved the life of two human beings. The mom can have some food. So the child didn't have the formula, so the child can get breast milk from that mom when the mom had food. So that made me so happy. So I brought some smile to my client.
Oh, that's awesome. Thank you for sharing that. Okay, and finally, we are in a pandemic still. Can you talk a little bit about the work you've done around COVID-19, whether it be helping people to get vaccinations or also helping them get the things that they need, like hand washing materials or masks? Can you just talk about what you've been able to provide? And then have you seen people change over time about how they respond to COVID and the COVID vaccine?
Yeah, I always take active role talking about the COVID vaccines and giving COVID education all the time. But when I do the assessment, I ask client if you have COVID vaccine or not, and then if they say yes, then I'll just give some precautions, still some education on the precautions, like just like masking, social distancing, hand washing. But for those who are saying like, no, I don't want to take vaccine, I don't want to have like that kind of DNA or like mRNA antibodies in my body, then I will just reinforce them, talk to them like every people are getting it, like you are not only the one you are getting. I got it. So this is my report. See, I had fever, I had headache, but I didn't end up in the hospital. I didn't have to pay huge bills. So those are the examples that I'm giving. And I shared my picture to some people like with the mask, like I got 2 vaccine, I got 3 vaccine. I have a picture in my mobile, that's why I'm sharing with my clients. That's it. I got it.
That's
So, and
awesome.
also when I order or request food pantries, that some of the food pantries are offering COVID test kits. Also, they offer some other disinfectants. So I'm just ordering those things for them and also referring them to this pantry. Hey, if you go to the pantry, ask for these things. And during the pandemic, I collect some COVID vaccine test kit from library and took it to our clients. So that's how I work with them, and I'm still working with them, encouraging them to get the vaccines.
Good, thank you. So is there anything you want to leave us with that we haven't covered that you feel is an important part of your job, or, something just to encourage people about the work that you do?
In addition with that, I would like to talk more about like trust building with the clients. Sometimes it's hard for us when we are on the phone, when you are not face to face. And even standing from my client's point, like if I am getting call from someone saying that, hey, I'm calling from County Public Health, I'm a community health worker, I cannot trust on the phone. So some of our clients, they don't trust us on the phone. So um, I myself, I'm going to see them once. Even during the pandemic, I didn't stop going to a home visit because I had to build trust with them. So I have to show them who I am. And like coming from different country with a different accent, it's hard for like people to trust you, right? So if I go to them, talk to them in person, they will know me very well. And they trust me, and they will also relay the message to the community, their family members, to their friends, and they will come and seek help.
Awesome. Well, thank you, Uma, for spending this time with us here at Health Impact Ohio. We really appreciate the work that you do, and we just wanted to spotlight you. So thank you so much.
Thank you, Tanikka. Thank you so much for having me here.